Ready to go.
Thank you. Good afternoon and welcome. I'm Mo Handel, Select Board Chair. This joint meeting of the Needham Select Board is being conducted remotely, consistent with current state regulations, and is being recorded. Public access to this meeting does not ensure that there will be public participation unless required by law. This particular meeting will not have public comment. We are joined by members of the Board of Health, the School Committee, the Finance Committee, Library Trustees, Park and Recreation Commission, and the Council on Aging. We also anticipate being joined by our state representative, Denise Garlick. Since the only action on our agenda will be a motion to adjourn, I will only call the roll of the Select Board. So when I call your name, please respond in the affirmative. Mary Ann Cooley?
I'm here, Mo.
John Bullion?
Here.
John Matthews?
John is not here, but I am.
I'm sorry, Dan Matthews? John Bullion?
Here.
And Matt Borelli.
Here.
I would ask that all members of other boards, committees, commissions, and councils to please identify themselves by their name and board should they be speaking. Anything shared or stated at this meeting will be a matter of public record. All supporting materials for this meeting, including the agenda, are available on the town's website unless otherwise noted. As a first order of business, I would ask for a motion that this meeting will be continued to a time to be established if it becomes necessary to have another meeting. So may I have a motion?
So moved.
Is there a
Second.
second?
Second.
Any discussion? And we'll call the roll. Dan Matthews,
Yes.
John Bullion,
Yes.
Mary Ann Cooley,
Yes.
Matt Borelli,
Yes.
and the chair votes yes, that's unanimous. In the event of it, welcome, thank you all for coming. This meeting is for us to update the status of the town's ongoing efforts to deal with the COVID-19 crisis and its consequences for our town and our town bodies. I am hopeful that we can accomplish that in an hour, but given the importance of this issue, I don't want to prevent anyone from the other boards from having their say or their questions answered. So if we have to go over, we will. Finally, given the number of us here, please use the raised hand function in Zoom. And if that doesn't work, wave. And if that doesn't work, please say something. Please also stay on mute unless you are speaking. Now I would like to ask Kathleen Brown, Chair of the Board of Health, to make her opening remarks. She'll be followed by Tim McDonald, Director of Public Health, and then by Dan Goodicant, Superintendent of Schools, both of whom will be giving a status report. We will then hear from Dave Davison, Assistant Town Manager, Director for Finance, and Cindy Ray Gonzalez, our Public Information Officer. Finally, then we will open up the floor for questions and comments from all of us present, from the boards and commissions, and State Representative Garlick, should she choose to say something. And again, we will use the raised hand function. With that, I'd like to invite Kathleen Brown, Chair of the Needham Public Health, the Board of Public Health, to say a few remarks, since this falls very largely in the domain of the Board of Health.
Thanks, Mo and everyone. First, I just want to start with saying I appreciate all the efforts of everyone on this call to respond to the public health crisis in our community. I know we all have different roles. Many of us spend both our working and volunteer hours on COVID-related work, and we're all experiencing the fatigue that this pandemic has wrought. I want to raise 3 points. One, cases are increasing and we are struggling to protect the most vulnerable. 2, keeping schools open for as much in-person learning as possible should be a priority. And 3, we can all take actions to reduce our exposure risk for COVID. Unfortunately, this second/third wave of the epidemic was predicted and will lead to many more cases than the first wave. While some comfort is provided by controls to protect the most vulnerable populations and great strides in treatments, the fact remains that cases are permeating the places we thought we were protecting, such as assisted living and nursing homes. We all know the value of in-person learning for our children. I think we should collectively focus our efforts on keeping the schools open. Many studies, other schools, and the town's own experience shows that controls such as masking, distancing, and ventilation have worked to reduce risk. And this has been demonstrated in the schools. The strong emphasis on the 4 W's in the schools: wear a mask, wash your hands, watch your distance, wait at home if you're sick or waiting for test results, have been implemented in the schools. And so far, cases have not been tied to exposures in schools. However, the great prevalence in the community increases the chances that a case will walk into a classroom. And so the rapid rise in cases and hospitalizations in this latest wave indicates that caution is warranted when considering changes in the school learning models. I'll also just say there's a lot of uncertainty about how children may spread or contribute to the spread of SARS-CoV-2 in the community. But one thing is clear, that more close contacts between a person and their household members and others, the greater the risk to them and anyone else they closely are connected with. So social interactions really need to be limited, particularly at this time. This includes reducing commitments for children's out of school programming, sports team commitments, family get-togethers, team dinners, carpooling, that sort of thing. We've already seen spikes in cases around holidays around the world, but also just in Massachusetts, 4th of July, Labor Day, Halloween. In other countries, they've seen dramatic spikes after holidays. Thanksgiving poses a real risk. I'll use Rob's phrase, which is the perfect storm: college kids coming home, gathering in large groups with members outside the immediate family, and connecting with older relatives who are at greater risk. Public health and town staff are working on echoing these risk messages to the community in Needham. Families have had to make heart-wrenching decisions not to attend weddings, funerals, see their loved ones for a last time. We can manage to limit some of our gatherings at these holidays and some of the children's activities outside of school. These are just some of the sacrifices we need to make to reduce risk in our community and help schools stay open, a priority in my opinion.
Thank you, Kathleen. Do you want to introduce Tim?
Sorry, and next, Tim McDonald will give a COVID update on the town public health division.
Thank you.
Thanks. I'm Tim McDonald. I'm the Director of Health and Human Services in the town of Needham. And because it's almost around 5 p.m. on a Thursday afternoon, my first thought is, what's our number going to be and what's our status? What color are we going to fall into? It's what I'm sort of thinking about every Thursday around this time. So I'll just give a brief, we expect to be at the top of the green category like last week, with a average daily case number just under 10, probably 9.1, 9.3 over a 2-week period. So that's roughly in line with our number from last week. It's unlikely, in my opinion, that Needham will enter the red category, given the revisions to the state metrics that the Governor Baker introduced 3 weeks ago. It's important for residents to understand they shouldn't interpret that to mean that there is no risk of spread in Needham. We have a risk of spread. There is community transmission. We would have already been in the red category if the old metrics were used. And part of the reason we are seeing comparatively high for Needham, the highest point we've been, level of spread, is family and social interactions. I want to talk a little bit about the current situation in Needham and some of the data we have for the past few months. And then I'll try to cover a few larger points before I pass it to the superintendent. I'm going to share just a few quick slides with folks. Hopefully folks can see a very simple COVID top slide. I asked the public health nurse and assistant health director, Tiffany Zeich, to pull data for the past 2.5 months. Basically since the start of maybe when school would normally have resumed. You can see our case breakdown is fairly evenly spread across the age spectrum. I think that's important to know. Needham had a number of cases in the spring, which had obviously unfortunate outcomes because the cases were in assisted living and long-term care facilities. So a lot of Needham's cases were skewed, at least in the initial high point of the outbreak, to those more vulnerable residents. Right now, our distribution of cases is more even across the board. What is potentially interesting, at least to me, is pulling from 2-week state periods. So each of these kind of plates represents a 2-week period. And you can, each of the colors represents a 2-week period. And you can see sort of the age distribution. And you can see that lately, the highest numbers, so the darkest colors are these ones sort of right here. Lately, our age distribution for cases has been on the higher end of the scale. It's been in the 50 to 64 range and 65 plus. That's somewhat different than what the state is seeing as a whole. If you follow state data, you can see that a lot of cases in the state are increasing significantly in this area, the 5 to 18 and the 19 to 34 age categories. And I'll just give you some information, and please remember that the plural of this anecdote is not data, but we've seen 4 cases in the last week and a half where someone who is a teenager or early adult comes back into town, likely from college, tests positive for COVID, and then spreads it to 2 or more family members. We've had 4 cases like that specifically, including some older family members that are in the 65 plus category and some that are in the 50 to 64 category. The situation in Massachusetts right now is being driven, the increase in COVID cases being driven by family and community spread, family and social interactions. So I think it's important for us to kind of understand that, because that's how we can work to reduce the spread of infection and make ourselves and our community more safe. I'll just briefly go over our age breakdown in the month of November, and you can see what I was talking about earlier, that this is our highest category of cases. And it aligns with what we had talked about. You can see obviously that this is our daily incidences. This is our sort of state rate, for lack of a better word. You can see that we're at the high point we would have been. We're higher than we have been since the state introduced this metric in mid-August. That's why it's important for residents to take seriously that even though we're not in the red category, there are steps we need them to take to help keep themselves, their family, but their whole community safe. I'm going to stop sharing, and one of the things we really need residents to do is to limit their activities and to really prioritize. We've had a number of cases where young students, young people who would normally be in middle or high school have been doing, multiple sports in one season, playing on multiple teams in hockey, and also a soccer team, and also a lacrosse team. Each of those interactions exposes that person to potentially a larger number of people. So every time we have a case of someone like that, the number of close contacts they have is significant. It's not 3 or 4 or 6 close contacts, it's dozens of close contacts. That makes contact tracing harder. It makes the likelihood of transmission to more people, and therefore the likelihood of an increase in the virus much more likely. We also need residents to monitor how and where they spend their time. I think it's important to understand that the way we control the spread of the disease is we keep people away from each other. So, we talk about social distance. We're talking about staying more than 6 feet away from someone. We're talking about not getting close to them, and certainly not getting close to them for any period of time in a row. We want less than 15 cumulative minutes. So residents, if they are really hoping to try to cut down on their exposure, need to understand that they have to stay away from anyone who's not in their immediate household. One of the things that's a concern to me is that lately we found a number of residents have been disregarding state and local rules, and rules that are designed to keep them, their family, and their community safe. We've had, unfortunately, cases where people have traveled out of state to higher risk communities and have not followed the state travel order. They have not tested or quarantined when they return to Massachusetts. And that is unfortunately an instance where they're ripe to spread COVID. In some cases, we have situations specifically where that happened and transmission has occurred. We have people who are hosting indoor gatherings. We had a discussion with a resident who I believe thought they were acting appropriately. They said, well, there was less than 25 people in my house. And I think our concern was, well, first of all, the state order says you can only have 10 people in your house indoors. And second, that is an incredibly risky activity to have 25 people unmasked in your home. And the fact that members of the Needham community would do that tells me they're not taking the risk of the spread of COVID-19 seriously, and it's a real cause for concern. I do want to talk briefly, if I could, because if we continue to disregard those rules, we're quickly going to get into the yellow category. Cases will continue to grow, the risk in the community will continue to increase, and we may have to consider changes to our posture. I think we, in the public health division and the town as a whole, really want to help inform and educate people, because we believe that Needham residents are almost universally very concerned about themselves, their loved ones, and their neighbors, and they want to make the best decisions for those groups of people. But if we continue to see people disregarding the rules, and if we continue to see people that lie to our contact tracers, we're going to have to consider a different posture from the town in terms of how we respond to individuals who don't disregard the rules. Two other quick notes, if I could, and this is partially in response to questions that we've been getting. A number of folks on this call may have seen positive news from pharmaceutical companies about potential vaccines for COVID-19. There's still a lot that's unknown. I do want residents of Needham and the folks that are on this call to be aware that we've been planning for COVID vaccination for a long time. I think we started back in May. There's a number of unknowns. Our plans are in progress and are constantly subject to revision as we get more information from the feds or the state about how vaccine will potentially roll out, when it will potentially roll out, which is a big question mark, at least right now from the state and local perspective. How it will have to be stored and handled. I think many people have heard about some versions of the vaccine needing ultra cold storage. We've been treating this very seriously. We did all of our flu clinics this year in the town of Needham under sort of a different approach, and we did them in accordance with HSEEP, the Homeland Security Exercise and Evaluation Program, because we treated them as a driller exercise for a real world event. We wanted to see what went wrong, we wanted to identify areas for improvement, and we wanted to tweak our plans so that we're going to be better when we do have the COVID vaccine. So I think in response to some resident questions, we are taking that seriously. Needham has Tiffany Zeik, our Assistant Director of Public Health, Taleb Abdel-Rahim is our Emergency Management Support and our Medical Reserve Corps Coordinator, and Michael Lathan is our Emergency Management Administrator. We have a number of very smart, hardworking people who are constantly working on our vaccination plans, and we will be ready whenever the federal or state government gives us the go-ahead. One other note, I guess, just briefly, before I pass to the superintendent, we have get a number of questions about mask enforcement. The governor, when he did revise the order limiting the size of gatherings, also imposed an emergency order that expanded the face covering requirement statewide to include basically any time you're in the public realm, whether that's indoors or outdoors. The only time, at least from the state's perspective, that you should not have a mask on is when you're in your private property, like your house or your yard or your car. We have gotten concerns and requests and questions from residents about why we are not, as a town, the Public Health Division and the Police Department most notably, stopping residents who are walking in the neighborhood without masks on. We also get a number of concerns and complaints about restaurants or other establishments where either staff or customers are not following closely the state order. Residents should understand that the likelihood of COVID transmission outdoors is greatly reduced. We don't believe it is a good use of town resources to stop individual people on the street and write them up, give them a ticket for not wearing a mask. We do respond as soon as possible to every complaint about an establishment, and we work with the businesses to make sure that them and their staff and their customers understand that the risk of COVID transmission indoors is serious, and that they need to have a face covering on unless they have a medical condition that precludes them from wearing a face covering. I know we've gotten a number of questions about that, and that is, I think, a smart posture. I think that's the best use of our resources as a town. But I know we've gotten questions about why we aren't writing tickets to people who are walking in the street without a face mask. We'd encourage people to make sure they do make every effort to wear a face mask, but it's not an activity where we're going to start chasing people down and writing tickets. I know I've been talking for quite a long time, so I'm going to pass it on to Superintendent Dan Gutekunst.
Thanks, Tim. I too Thanks, folks. Good to see you, and thanks for taking the time to have this check-in. To permit me, I have just 3 or 4 slides I'd like to share with you to provide some context about what's going on in the schools. So if I can do that, just take a moment. So what I want you to know that we've in our planning for this particular school year, we had 2 priorities in order. The health and safety and well-being of our students and staff was and will remain our #1 priority. And then secondly, the school committee, the administration, teachers, and families wanted to make sure that to the degree it's possible, we could get students back into the schoolhouse for the kind of learning that we know is important, beneficial, and developmentally appropriate for them. So health and safety first, getting our students in school second. Both actually complement one another. I also want you to know, if you do not have children in the schools, that we actually have what we call a hybrid program that has 4 cohorts. I won't go through all of this, but suffice it to say, we're using 4 colors. Our blue and gold cohort are the majority of our students. And they attend roughly, students attend school for 1 week. Half of our students, the other half learn from home, and then they swap. The green cohort is another group of students who attend most of those days in both the blue and the gold cohort. These are children who are most vulnerable students. Also, we have students of educators who are invited to participate in this cohort. And then the red cohort, which comprises about 600 students pre-K through 12, are learning completely remotely. This is essentially a 9th school that we've created on the fly in Needham over the summer to meet the needs of about 600 students pre-K through 12. And these are students, many of whom have a health situation at home or who have asked to learn remotely. Those are the 4 cohorts of how we are providing school this year in Needham. I also want you to know, as I said from the beginning, the health and safety is our priority. And to that end, we've established a joint committee on health and safety. There's some folks on this call who are participants in that. Tim McDonald is taking a lead role in that joint committee with me. Connie Barr in the school committee, who also is a physician. And the joint committee has been meeting weekly since late August. We meet Monday evenings, we meet every week. Our purpose, our role is to advise and guide decisions around school health and safety during this time of COVID. We also look at state metrics, and the committee will advise me on the opening or closing of schools based on those metrics. And we have 3 measures we're using: the State Department of Public Health and Department of Elementary and Secondary Education metrics, positivity rates below 5% using town, and we dig into town, county, and relative rate of change. And then also, finally, we look at our expectations for health and safety, including how students are doing with mask wearing. And I can report to all of you, our students are doing an excellent job wearing masks in schools. There essentially is no problem with that. Maybe a couple of issues on the bus to and from school, but really only a handful. Our kids are really doing a great job. They're also doing a great job with hand washing and hygiene. By the way, we measure all these things and we survey our staff. We make observations and we tick off numbers. Physical distancing will always be a challenge, particularly for young people, and it remains a challenge, but we're working on it. We have our schools. You've not been in our schools, I'm sure, but they have up and down staircases. Certain hallways are one direction only, things like that to help meet physical distancing. And also with the town support, we have created standards for appropriate ventilation in all of our schools and classrooms. This was an enormous and expensive undertaking over the last several months, but it was the right thing to do because we know that the combination of mask wearing, physical distancing, and appropriate ventilation is going to help us keep our schools open to the degree that's possible. So these are the 3 measures the Joint Committee looks at. The first one I just want to share with you, as Tim mentioned, they have changed recently. And as Tim mentioned, Needham is in the green currently, in the middle column, the 10 to 50,000. And what I also want you to know is that the governor and the commissioner have emphasized that in the gray, green, and yellow, districts should prioritize in-person learning to the extent possible. Now, to the extent possible means that we have to maintain within our schools 3 to 6 feet of physical distancing between desks and an absolute 6 feet in the cafeteria between students. Plus, we can only have about a quarter of the number of students on our buses as we typically do. So the logistics are huge and complicated, and making sure that we can have the right number of students with the appropriate physical distancing remains a challenge. And that's why you may have heard some people saying, well, let's bring all the kids back to school. It is not possible at this time, despite the fact that we are in the green and despite the governor's urgent call to bring students back, because we also must maintain guidelines around keeping students separated up to 6 feet in our schools and classrooms. Unless that metric changes, we still will only be able to have about half of our students in school at any one time. Last slide here, as was mentioned earlier, we are trying to emphasize the 4 W's: to wash your hands, wear a mask, watch your distance, and wait at home for test results. Our website has a lot more information. I'm not going to go into it, except I do want to point out to you that on our website, we do have a COVID dashboard that does show what our daily and cumulative cases are for COVID in the schools. Sadly, I think by the end of the day, you'll notice on this dashboard, we have every school listed and including the central administration building. These are current positive cases for this past week. And then there are the cumulative cases. So since the beginning of the school year, there have been a total of 27 cases. We have not specified whether there are students and staff. Frankly, that doesn't really matter for our purposes. We wanted to protect personal information. And also, really, we're just looking at the total cases. So the 27 total cases, you can go onto the dashboard and you can adjust the week to see where some of those cases were. Sadly, I think by the end of today, this column will change again. I think this has been a tough week in Needham, and I think I'm eager for the week to conclude. But I think this column will change by this evening. So this information is available for the public to look at, to understand where we are, and then they certainly can ask families, or the families can ask principals questions. Last thing I do want to mention, if I may, is as I finish, Tim said something, and I want to make this plea actually to the Board of Health, and it's this. I am concerned about the number of cases that are coming up, particularly at the middle school and high school. I will tell you that today, and I'll stop sharing now. I think that's no longer necessary. Today, at Pollard Middle School, we had 16 staff members absent. Most of them absent because they are either being quarantined or isolating at home. To give you a perspective on that, last year on this very day, we had 6 teachers absent. At Needham High School, we had 13 staff members quarantining or isolating at home because of COVID. Last year, today, we had 5 high school teachers absent from school. When those teachers are absent, we have to hire substitutes. We have to bring in resources, and this is happening now increasingly every day. That's consistent with the surge in Massachusetts, and perhaps that will be with us for a while. What I wanted to say to our friends on the Board of Health, from my perspective as your superintendent, I very much appreciate your desire to keep our schools open for in-person learning. I think one of the ways that we have to do that is by encouraging folks to do the right thing, providing incentives, perhaps the carrot, but I also think there's a stick. And that, I believe, is up to a $300 fine that the Board of Health, as I understand it, can levy to an individual for violating one of the governor's orders. And I, on my behalf, speaking personally, as your superintendent, would encourage the Board of Health to levy as many fines as you possibly can for any family or individual who is breaking those rules that have been set up to keep us all safe. Because without folks paying attention, not hosting large gatherings, or ignoring some of the mandates that are trying to keep us safe, we will have to close schools. So To the degree that is feasible and reasonable and possible, I would absolutely encourage the Board of Health to consider that. That's my update for this evening. I'm happy to answer any questions that may come up.
Thank you very much, Dan. I appreciate that very much. Dave Davison, Assistant Town Manager and Director of Finance. Can you give us an update, please, Dave?
Certainly, Mr. Chair. The town, first remarks I want to make is relative to what the town has been doing in its response to COVID-19 in terms of the expenditure side. And that is the town has been redeploying its resources, its staff, appropriations meant for different programs where we have scaled back in order to address expenses that are related to COVID-19. Secondly, there have been external funding sources that have been made available to cities and towns and school districts across the Commonwealth from federal and state and private entity resources. And the town of Needham has received such grants. In the area of public health, the town to date has received some $34,000 in grants to help them in their efforts to addressing COVID-19 related services, expenses, and outreach. There's also some reimbursement programs, which is helping the Health and Human Services Department in the area of transportation, especially for elders, to assist in covering some of the costs that the town may be incurring in order to provide certain transportation services to the elderly and shut-ins. The town, and I have to state these because people have been hearing a lot about FEMA, the Federal Emergency Management Agency, and MEMA, Massachusetts Emergency Agency. And each one of those are providing resources or reimbursements of a certain percentage of eligible expenses. But it is understood that anything that may be funded in part or whole by an external grant or another federal or state grant would not be something that you could submit for reimbursement to FEMA or MEMA, and that makes perfect sense. With that, we have identified on the town side of actual expenses. These are not anticipated expenses, but money that the town has already paid out as of the end of October of $1.2 million. Primarily on the town side, more than 58% of that total expense is not unexpectedly been in our building maintenance department. Our building maintenance department is the division in town that cleans and disinfects all the buildings in town, school buildings and municipal buildings. It is the department that works and maintains the town's infrastructure within the buildings. That would include HVAC systems. And those are two particular areas that have been expensive. The school system has been incurring expenses, as one would expect, with a combination of remote learning and additional staff that they have had to bring in. The school department has had resources made available through the Department of Education from the Commonwealth, but there is also other expenses that we have taken upon from the school department to seek for reimbursements from what is referred to as the CARES program. And to date, the school department has incurred about 30% of that $1.2 million in expenses. Between the building maintenance division of DPW and the school department, that is 88% of the total expenses that have been incurred that may be eligible for reimbursement, either from FEMA or from the CARES Act. The rest of the town departments account for the other 12% to date. And again, partly that is because we have been focusing resources that were intended for certain programs and using them to cover the expenses of dealing with COVID-19. A second thing that's very important is any expenses that might have been covered by an appropriation prior to March of 2020 2020 is not eligible for reimbursement. It's only for costs that were not anticipated or could not be anticipated at the time that the budgets were formulated. And Mr. Chairman, at the appropriate time, I will take up questions specific to the COVID-19 expenses.
Thank you very much, Dave. That brings us to Cindy Roy Gonzalez, who's our point person for communicating all of this information around COVID-19 and everything else to the rest of the world here. So go ahead.
Thank you. Thanks. With the help of many, many other people on this meeting. I'm just going to go ahead and share my screen if that's okay.
Please.
Can you all see that?
No, not yet.
Okay.
Sandy, do we need to do anything to enable that for Cindy?
Let me see what I can do here. All I can think of is
There it is. It's coming.
oh, there we go. Yay!
Okay, so I'm going to go through this fairly quickly so there's enough time for questions and answers, but I wanted to talk about two messaging campaigns that we're working on with public health and with the schools. So there are two main messages that we're wanting to get across to the community. The first is on the issue of face covers, which a couple of weeks ago, the governor updated the requirement to insist that face covers be worn indoors and outdoors, regardless of the ability to distance. And so we're working on a pedestrian campaign around the downtown center and some other high traffic areas in town. The other message is targeted towards the young people who Tim referenced earlier and Dan referenced are doing a great job in school of adhering to the rules, but are participating in lots of activities outside of school that are contributing to the increase in cases. So we have been working on face cover campaigns since the start of the pandemic, which includes some of the images you've seen around town and you see here. So we've had yard signs and banners, the big sign at Memorial Park. We use the traffic boards, the variable message boards, as well as our website and social media. These face cover campaigns were launched prior to the governor's updated face covering mandate. And so given the new requirement and given the sort of fatigue that I think has set in with people about wearing face covers, we wanted to do a refreshed campaign that would accomplish three things. We wanted to get people's attention. We want to make sure that people know about the face cover requirement. And we also want to make people feel like they are part of keeping the community safe, that just by wearing their face covering, they're doing a lot. So we've started to work with a woman out in the western part of the state who has done some interesting and eye-catching campaigns around face covers and some other COVID-related campaigns. These are a couple of examples of what she's done in Williamstown. The sticker here that looks like a painting on a brick wall is actually a sticker. So that's something that she was able to put up in the downtown area of Williamstown. She did the banners as we've done. I like this wrap around the garbage cans. Again, we're trying to find ways to catch people's attention at eye level when they're walking in the downtown areas, which is where we're hearing people complain, right? People are complaining about other people not wearing masks when they're out on sidewalks in crowded areas. So just wanted to share a couple of these. And so the woman, her name is Julie Hamill, is putting together a proposal for us about what a Needham specific campaign might look like, and hope to have something next week on that. The other campaign targeting the youth campaign is a social media campaign. And so I need to thank Mary Lammy for helping pull together a good group, including Conductor Productions, which is helping us think through a social media campaign. So we know that kids are doing a great job adhering to safety protocols when they're in school, but it's the things we know they're doing outside of school that continue to be a problem. So that's hanging out in big groups without face covers. They're continuing to have, gatherings and sleepovers, and as Tim said, participating in multiple extracurricular activities. So how do we make people, young people in particular, feel invested in protecting themselves and the community? So just a very rough idea, subject to change, is this idea that young people by and large believe that they are invincible. And they've been told over and over again that, if they get COVID, it's not deadly for them. It's not that big a deal. So what if we acknowledge that, okay, they may be invincible, but the people that they spend their time with, their parents, their grandparents, their teachers, may not be invincible. And what can they do to protect those people? So our hope is with the social media campaign, we can do something graphically interesting using the platforms that young people use, different social media platforms, and really begin to get them to take some ownership over keeping the community safe. So hoping to roll both of these out beginning of December, which I think will be timely as college students are back for the holidays. And happy to take any questions, and I'll turn it back over to the chairman.
Thank you very much, Cindy. I notice our state representative, Denise Garlick, is here, and she's certainly welcome to ask questions or speak. Are there any other questions or comments that people would like to make? Please use the raise hand function. Steve Epstein, Dr. Epstein, go ahead.
Thank you. Steve Epstein, member of the Board of Health. We're putting a lot of focus on trying to keep the schools open, but I do want to make one thing clear, and that is, at least from what I can tell from the data, we are flying to some degree a little bit blind here. The numbers that we are seeing for the number of cases, and please somebody correct me if I'm wrong about this, are basically a random sample. So somebody has symptoms, they get tested, they turn out to be positive, we get that reading. If they are symptomatic again and they get tested, we'll find out if they're negative as well. But we are not doing blanket testing. We are not testing patients or students who are asymptomatic. And we know that there is asymptomatic spread that happens. We just don't know if that's happening at the school. So the point is that, lack of evidence that there is spread is not the same as saying that there is not spread. I know other school systems have considered blanket testing. I don't know if that makes sense from a fiscal standpoint, but I think it is something that at least should be considered, particularly as we look at the numbers in our community, which now, on that second bullet point that the superintendent noted, we have well exceeded 5% positivity rate in town. I believe at last check we were up around 8 or 9%, Tim, if I'm correct, for the past 2 weeks. So I just wanted to make that point that we really don't have all of the data that we would like to have to be sure that it's safe. One of the things that we do know is that sustained indoor contact is kind of the major problem here with spread of COVID. I'm delighted that there's adherence to mask wearing and all of that in the school system. I wonder what's happening in restaurants in town, and if we need to take a closer look at indoor dining, particularly as winter comes on. And other areas where we may see spread in the community other than the schools, of course. But we do need to start looking at this, and I think we need to do it sooner rather than later, because these numbers that we're seeing now are near the peak that we had in April and May of this year. And we have not seen the death toll start to rise yet. We hope it doesn't, because we're seeing more spread among the youth. But at this time in April and May, if you'll remember, we kind of pulled out the hammer in terms of stopping the wave. We're a little bit smarter now. We hope we don't have to do that. But the numbers continue to rise at a really alarming rate without any evidence of flattening. And we're seeing that not just here, but we're seeing that in all of our surrounding communities as well. So I can't emphasize how important the public messaging is. I'm glad to see that everybody is kind of on the same page here, but I do want to call attention to the urgency of the matter. Thank you.
Thank you, Steve. We've had 3 hands raised, and it'll go in order. Matt Spangler will be followed by Christina Matthews, who will then be followed by Dan Matthews, no relation. Matt, go ahead.
Yep, thank you, Mr. Chairman. I'm Matt Spangler, a member of the school committee. I'm also the parent of 2 teenagers at the high school, and I can say our family has been directly affected by the incidents Mr. McDonald mentioned earlier about parents disregarding the rules. I would like to make just a couple of points. One, I would be fully in support of the superintendent's suggestion to provide fines when families do not follow protocols and rules. And then, as Tim said earlier, having the town take perhaps a different posture when this happens. And then the second piece is, I think, related to the presentation on the media campaign. I know one of them is asking teenagers to do the right thing, and I think that's appropriate. But I think what we know about the teenage and youth development and brain research, they think differently than adults. And I can share that there is a sense, at least amongst the teenagers I know and their friends, that they are, even if they just stay together with the same 10, 12, 14 people, they are in a bubble. And that they are doing the right thing by doing that. So I encourage that we educate and continue to ask our teenagers, but I think there needs to be another campaign aimed at parents for things. And how do we get parents not to have sleepovers and not to have gatherings in the basement with more than 10 people not wearing masks? This, I think there's an opportunity. I am worried, especially as we get into the colder months. People will be coming back after Thanksgiving. I believe if we don't get news out now and have a firm stance with the parents in this community, these types of things are going to happen more and more often. So thank you for the time and for the invite to this meeting.
Thank you. After Dan Matthews speaks, Carol Fraschetti and then Matt Borelli and Josh Levy will be speaking. But the next person up is Christina Matthews from the Board of Health. Christina.
Thanks, Mo. I'm Christina Matthews from the Board of Health, and I was actually going to say what Matt just did about, including parents in our communications campaign. And I have 2 young kids, elementary age kids in school, and I think that is an ongoing issue that we have to decline invites to many different gatherings. So I think that continues to be a problem for us. And I do think, the mask campaign that Cindy had spoken about, for outdoor masking and these types, I think that, we're seeing that spread is happening through family gatherings and some of these indoor sporting activities and things like that. So I hope our campaign can kind of focus on those areas, because I do hear families talking about plans for Thanksgiving, which is next week. So I'm hoping, sometime before that, we can begin to roll out some messaging. And something that I think seems quite effective that I've seen some other places do is this messaging that, we stay apart now, so when we gather, no one is missing. And I think that kind of might hit home for some folks, especially as people are making Thanksgiving plans. And this idea of the bubble or testing, right before we get together. And there are so many holes in those arguments that perhaps our messaging could also clarify that for folks who think, they're going to get tested and then get together with grandma next week. The reasons why that doesn't quite work. So that was my input.
Thanks, Christina. That brings us to Dan Matthews.
Yes, thank you, Mo, and thank you all. I think based on one, I think based on the superintendent's comments, if you feel that you've gotten to the point where you need to have sanctions, my recommendation from other kinds of situations that we've worked in is write as many tickets as you need, but do it at the lowest dollar value that's available to you. If you go out at $300, you're you're at risk of setting off a kind of a point, because a lot of this problem originates in some of this chaotic messaging that we've had from the beginning, from the national level. Big tickets just can set off this kind of libertarian reaction, and people will feel that they're justified in litigating over it because they're going to might save some money. But if you write a lot of small tickets, as many as you need to get compliance to anybody that's willfully not following the rules or pushing back on you, I think the point gets out quickly, particularly when they go and complain to their friends and neighbors about the $25 ticket that they got from us for going into a donut shop without a mask or whatever. They're going to get some negative reinforcement from just about anybody that they talk to, and I think that that will help you. A second element just has to do with the schools, and it's great to hear the superintendent's report on this, your priorities, safety first, and getting back into the classroom. That's the right priority and the right key. You don't need any more backseat drivers on this, because I'm sure you're already hearing from all of them. But don't be shy if you need more resource. If you've got a plan to do some improvement or to increase in-person instruction, don't be shy about asking for resources. We may or may not be able to do it, but we want to hear and want to help, because it's a real stressor for the families and then the communities, and whatever we can do will actually help us get through this. And then the last thing I would do is to stress the idea of positive reinforcement. I know you folks are kind of having to deal with the issues of people pushing back and the willful noncompliance and some of this other stuff. You're seeing the worst side of this thing. I see tens of thousands of people following the rules, being careful, respecting their neighbors, taking these things on, even though it's a burden for people and it's tough. And as I said, in relation to the schools, they're complaining, but they're doing what they're supposed to do. I think the more positive, if we had a way of introducing, and maybe Cindy is the person that will get the job of figuring this out, but the positive messaging about how hard everybody is working to do the right thing, and how many lives we've probably saved because they've done that. And setting even aside, we know the nature of this disease, all of the other kinds of harms that could have happened that haven't happened. And the fact that we're in the green, that's not where we want to be. We'd like to not have this around at all. But people have worked hard and patiently and persistently, and I hope that we get that message out to the public, because the work of the staff and the board members has been terrific, and the response of the overall community has been terrific too. Thank you.
Thanks, Dan. That brings us to Carol Fraschetti. Carol, from the Finance Committee.
Yes, can you hear me okay?
Yes.
Thank you. I have a comment and then actually a question for Dan Gutenkans. I share Dan's frustration and desire to try to reinforce the rules with something, that there's an economic cost to it. But at the same time, you want people to be honest. I think that's particularly important for the respective of contact tracing. So you want them to pick up the phone and admit who their contacts were if we're going to try and nip this, to nip this in the bud. And so it almost sounds like, in my mind, it is about messaging, but it sounds to me like you have to, it's a bifurcated message. So you have to focus on the young people, but from Tim McDonald's data, sounds like you have to focus on the 50 to 65-year-olds that seem to be partying in their backyards, And so where the high schooler, doing what they're doing is potentially could cost their parents or grandparents to get COVID. The 50 to 65-year-old that's having a gathering in the house, but it's only 12, need to understand that the cost of that is a young person can't go to school in person. So I just think everybody has to have a stake in this. And, you know, so I know Cindy and Tim will be working on that. I shared Dan Matthews' desire to have it be a positive message, to almost be like, we're so close, we can hang in there, like a vaccine is on the way, but we need to work together to get there. And then, so that's my statement. And then my question to Dan is, have you thought about, I know some schools are considering just, let's say, a 2-week remote period around the holidays to kind of quell some of the transmission that might happen around family gatherings. Is that something that we've considered?
Go ahead, Dan.
Thanks, Carol. Yeah, first of all, by the way, regarding fines, I think I recognize it's a complicated issue, and you do want compliance, and you want people to follow up on contact tracing. I guess, and to Dan Matthews' point about maybe a smaller fine gets the message across. It doesn't necessarily have to be a hammer, but it certainly, if it's a tool that helps share, to let the community know and families know, whether they're 50 or 15, that we're taking this seriously. And of course, obviously, everybody on this call is taking it seriously. I think whatever tools we have appropriately applied can help get out message. We're not going to get everyone, but if we can save some grandparents from getting ill or some high school students from getting sick and not coming to school, that I think is worthwhile. But it's complicated. It has to be measured and balanced. And I think there's enough wisdom on this call, and certainly within the Board of Health, to decide what is the best course of action. I just want you to know that as your superintendent, you have my full support in both encouraging young people and adults to do the right thing. And if they don't, as happens in schools sometimes, there's a consequence for the behavior. That's an important life lesson for all of us. Carol, we have, it is certainly something I know communities are considering. I am not aware of a community around us that will be taking the 2 weeks after Thanksgiving. The Joint Committee on Health and Safety has not taken that subject up. Certainly may be part of our conversation this coming Monday. My preference, because school time is already incredibly precious and hard to find, in-person school time, my preference is not to send a message that we're closing school. My preference is to say, let's work together so that we can return to school safely. Because to be honest with you, if it's 2 weeks after Thanksgiving, then it should be 2 weeks after the winter break as well, and or after the February break. And so I don't want to say it's a gamble. It's a calculated risk that we are taking. And I'm convinced that our community, our families, both in Needham and Boston, will do the right thing, and that will be safe. That's a hope. It's an expectation. I think the right things are in place to encourage that, and I hope that's what will happen.
Thanks, Dan. Before we go to the next person, I'd like to note that one of the attendees on the public side of this meeting has a hand raised. We cannot take questions from the public, but I would urge you to send your question or comment to the select board. You can get that information on the website on how to do that, and then we will try to respond offline. The next person is Matt Borelli. I noticed that the town manager also wants to say something. Kate, is there a reason to go out of order?
Mr. Chair, I just wanted to ask if you could recognize Tim McDonald to answer a question about the fine schedule.
Of course. Thank you, Kate.
So unfortunately, there are state orders from the governor in place, and local boards of health have been given the authority to enforce those. Those come with a $500 fine per instance, no lower, no higher. So there unfortunately is not the opportunity to give lower fines for violating those state orders. And to Dr. Epstein's comment earlier, I do think there are different ways to calculate positive testing rate, but at least the way the state has calculated it, we're at 1.03 last week. So we haven't gotten up to 8, at least in the way the state is sort of producing that information.
Thanks, Tim. That brings us to Matt Borelli. Matt, the floor is yours.
Thank you, Mr. Chairman, and thank you all for attending this. I don't want to get into a debate on fines, but I guess where I'm sitting, I think it's a last resort. I think it puts people in law enforcement in a very tough position. And I think it is kind of counterintuitive to the whole idea of being honest and contact tracing that Carol was talking about. So to me, I would not be in favor of that. I just have some notes that I've been written down here. There's a lot that's been discussed. I think the school's done a phenomenal job. I'm a parent of a Pollard student and a high school student, and I'm hoping as we reopen eventually that we use some of those guidelines to have, the in-person meetings that I think we're all hope is the goal at the end for us. But I think we can learn a lot from what they've done. This is a little bit off and maybe counter to what we're discussing, but I think restaurants, as we move into the winter, are going to be struggling. And we have to balance, of course, the health with the economy. And, we had the shutdown. It was very difficult and we were able to outdoor dine. And I'm looking to see, and I know right now we're rising, but when we get to a point, how can we have a campaign or a discussion that it is safe? Because what I'm reading, and maybe Tim can answer this, is that indoor dining isn't really a major super spreader if it's done with family, let's say, or 2 or 4 at a table and done correctly. So I think there is a way as a town to encourage that. And of course, there are many people that won't go into a restaurant. The idea is not to push that to happen, but for those who may or are wondering if it's safe, if there's a way to encourage that to happen in a safe manner. And I don't know what that manner is, but I think that's something that we should kind of keep our eye on moving forward. Lastly, the messaging. I see when I'm walking around town, and I know outdoor spread isn't that great at all. So the outdoor masks thing, I guess when people are close, I understand it. And indoors when you go to a Roach Brothers or Sudbury Farms. But what I see, and I think most people do, is there is compliance among adults. I don't think I've been into an indoor place like a grocery store in Needham where I've seen someone without a mask. So I think I want to spend the energy on the campaign. And even outdoors, I see now people all the time with masks, going to my office building, walking outside, and I spend a lot of time in Needham. So I just want to make sure the focus, and I think it was said before, isn't completely on these adults that are almost 99, 95 doing these things. It is when I see the use in large groups, with their bikes at Walgreens or, walking around. And I think we just have to be careful of the target market and who we actually focus the message on. I do like the idea of a positive message, but I think that, the youth, as was talked about, and about the sleepovers, I think Matt Spengler talked about with parents, those large groups of kids doing things. So targeting the parents of youth and the youth, I think would be more productive than the adults who I really think are being compliant. So that's my 2 cents on comments. My last question is about our hospital capacity. I know at the beginning of COVID, there was a concern about the BI, and they were able to really handle the cases. Are we looking, as we look forward, that may be an issue, that we're going to start getting the ICU and hospital visits, and are we prepared for that? And are the cases that we saw, how are the health of the people that we're seeing the cases? Are we seeing kind of the death rate start to increase? Just trying to get a Needham focused discussion on what we should be preparing for. And with that,
Tim, can you answer that? And I would note that the BI is a regional hospital, so it's not just Needham cases.
Sure.
Go ahead.
So most of the hospitals around the state are operating at somewhere, at least according to state data, of ICU beds at about 70 to 75% capacity. That does include the Metro West region, which is at 72% capacity. I do think, we have seen, because of experience that clinicians like Dr. Epstein and Dr. Partridge have gotten as emergency department physicians, the outcomes have improved. The therapeutic interventions that are possible in a hospital setting have improved, so that in Massachusetts, the fatality rate is not as substantial right now as it was in the spring. I do think you're seeing around the country, though, very high high hospital capacity being taxed, and certainly when hospital capacity is overtaxed, that's when you'd certainly see fatality rates increase. I think Rob was recently in Montana and could probably talk to us all about that and tell some interesting stories about providing excess capacity to Montana because their lack of hospital capacity is creating a serious public health challenge.
Thanks. Does that answer your question, Matt?
It does. Thank you.
Thank you. We're going to be hearing next from Josh Levy, followed by Michael Grice and Marianne Cooley. Dan Matthews has spoken, and I note that Representative Garlick wants to speak or ask a question. So if Dan doesn't mind yielding to her first, I'll go in that order. Josh, please.
Thanks, Mo. I just want to make a point about the metrics and considering them alongside all the tools at our disposal. So I guess the three main tools I heard are fines, the public information campaign, and then the possibility of at some point, not the desirable possibility of closing in-person learning. I would just want to make sure that we make sure that there are benchmarks in place using the metrics at our disposal, so that either the positivity rate, the absolute number of cases in town for when each of those types of policies would be implemented. But then also we can benchmark the success of those policies against those metrics too. So I'm sure the public information campaign is already underway. We can track when it starts and how much cases have gone down, since it started. If it's a success, let's keep going. Let's do more. If it's not a success, let's have the flexibility to shift and pivot to something else. And I think with fines, we can do the same thing. We can set a threshold, and someone mentioned carrot and stick earlier. If we happen to hit a certain threshold of cases, we can start fining and be very strict about it. And then the carrot side is if we go below that, we can stop fining. So I think looking at the metrics and using them to benchmark the success of all of these tools we have at our disposal is very important.
Thanks, Josh. That brings us to Michael Grice. And before we go, Michael, Denise, do you have enough time so that if we hold you for some of the other speakers that you'll be able to remain? Thank you. All right, so Michael Grice, please.
Thank you, Mo. First of all, I want to note that as Tim has projected, we are indeed in the green again this week, and our numbers, maybe a little surprisingly to me, are actually slightly better than last week's in the report that just came out from the Commonwealth. I first want to, I know Dan has said this, but I want you to hear this from a member of the school committee, how much the schools and our entire community appreciate the incredible mobilization on behalf of all the town resources to help us get school open. It is something that we deeply appreciated, and thank you for the support and the encouragement to ask and to come back in order to keep this going and to improve it. I am one who has not been shy to deploy our youth to help send messages and communicate with the adults in our community. So along the lines of Dan Matthews' comments, I would encourage us in the information campaign to also deploy our kids. If you have watched any of our school committee meetings, you have heard kids from 1st grade to 12th grade just speak about how powerful it is and how important it is and how wonderful it is to be back in school, probably more than would say that in a given year. I think our staff too, after being, understandably concerned, feel great about being back with their students. So, as part of the positive message, that's a message that should get out as well, because to the point that Matt and Dan and some others have made, to reach the adults, sometimes you want to get the kids. And yes, we have messaging to get to the kids, but the kids can be a powerful source of messaging to our adults. And then I have a question, I guess, really for the town. Would we consider looking at some things like the pooled testing or the programs that might allow us to deploy a larger scale testing to, say, parts of the community, whether it was parts where the elderly are or a Pollard or a high school? I know that, Somerville is doing that to do all their schools, but is that something we would consider doing to get a larger amount of data on, where the spread is and some of the concerns about asymptomatic spread?
Thanks, Michael. I'm going to ask Tim if he wants to handle that.
I think in part, I might need Michael to rephrase the question about pool testing. Can you tell me a little bit more about what you wanted to?
So I'm not saying I want to do it, but I know this is something that's come up and recently, the Mayor of Somerville, they're using that in the schools, where they basically do, they basically take samples from a group,
Yep.
They test one in the sample, and then if it comes back positive, then they test the rest. So in essence, they're sampling a much larger group, and then they're focusing down. It is, I'm not saying that we should do it, but it is one vehicle, absent the ability to go literally get thousands of tests or hundreds of tests, to be able to test a larger group and get some potentially some data that is less anecdotal than, you get tested when you're exposed or when you have symptoms.
So if I could, Mr. Chair, can I call on Kathleen, who has done a number of work on sort of testing for secondary schools, private secondary schools and colleges? Because I think she would be able to answer that question better than I can.
Yeah, the pooled saliva testing is what Wellesley Public has gone to. They tried a swab thing that was a one-day event. It's still $25 a sample for, Wellesley's getting it at cost for $9 a sample. They have a funder that's donating. So, but yeah, it lets you narrow the pool down to 2 people, and then you still have to do PCR, on the one or the last 2 cases. So yeah, it is something that works. It costs money, and you're screening thousands of, you have to really screen twice a week probably to get to avoid an outbreak. So it's an expensive endeavor. So far, the prevalence has been so low that you are more likely to get false positives than than true positives. So it's a lot of money for not a lot of bang for the buck, I guess is the point. But I understand the interest, and schools are doing it. I mean, some are. Many other schools have just opened without it. So
Thank you. That brings us to Marianne Cooley, Select Board Member. Marianne?
Hi, I'm sorry because I did have to leave for a work COVID call at one point, so I'm hoping I may have missed something. I am wondering if we can give the state some feedback on fines, and certainly having Denise here, she would hear that the $500 fine, well, we understand that's what the state's given. It's actually at such a level as to be not useful and not helpful. And some more discretion maybe on the part of the town as part of a strategy would be helpful. I'm also wondering, Tim, did you say, and did I miss, are we able to do more flu clinics? Just thinking on other remedial fronts. Is that an option?
We certainly do have some additional vaccine, including some high dose. We did clinics actually both yesterday and today at the Needham Housing Authority properties. But we do have additional vaccine if people are looking to be vaccinated. I think a little bit under 200 doses, but that's still a substantial amount.
So getting the message out about that is another public health message that I think it makes sense to continue to reinforce at this point in time as we head into the new year. And then I do agree with all the sentiment about positive message about, the ability that you do these things because you care about your community. And it's interesting to me that it has been such a challenge on the contact tracing front, because I know from the Wellesley College front that our employees are actually so invested in protecting the bubble there that literally you call somebody to contact trace and people are like, let me spill my entire life to you. And so it's a really different reaction from the one that you're describing, which is interesting to me to hear. But it's because there is such a strong messaging around that protection of the community, and we're all in this for each other. And if we can lean on that maybe a little bit more, hopefully it can help us here too.
Thanks, Marianne.
Thank you, everybody, because I know it's just a ton of unrelenting work right now.
All right, that's a nice segue to Representative Garlick. Denise, the floor is yours.
Thank you. So always appreciate a segue. First, I want to say I'm so grateful to be here with such an amazing team and know that each one of us carries our own responsibility. My responsibility is to be sure that I'm hearing the voices of the community, and to the extent that I can be helpful, whether sharing information or looking for resources, you know, I want to do that. I've been trying to engage certainly with the town around these issues, understanding what's happening in the schools. I am in touch with the hospital and have regularly scheduled calls with the hospital. And someone has raised that as a concern. It's a very justifiable concern in what we're seeing in the hospital presently. And you may know that our local hospital is not only seeing a rise in COVID cases, but we are now the receiving hospital because Norwood Hospital has closed. There are more emergency response vehicles pulling up to Beth Israel Deaconess Needham from Norwood than there are from Needham itself. So we have to think about that impact, and I'm beginning the work on that, hopefully with the State Department of Public Health. But I wanted to put a few other groups on the radar screen that I'm trying to connect with as well. Certainly the Needham Housing Authority on an ongoing basis, and congregate care for us in our town. If we're thinking about the number of group homes that we have in Needham, there are a number of them that are presently under quarantine, and what that might mean to us as we think about the community as a whole, and around the number of nursing home and assisted living with staff that are coming and going. So I'm thinking about that. I wanted to share, I've got concern about the metrics. I was deeply concerned with many of my colleagues and engaged in a call with Secretary Sutters this week on the change in the metrics and how useful that may or may not be around positivity rates. You know, there's a million debates, and I'm not an epidemiologist, but around prevalence. And I think the way we interpret that, I want us to be very mindful about how we interpret that number ourselves for our community. It is not lost on me that we had 121 communities in the red zone. The state changed the way they were calculating the metrics in response to rural communities and in response to some businesses. And in a 24-hour period, we went from 121 communities to 16. So I want us to be very mindful in the red zone. I want us to be very mindful about those metrics. And on the messaging, if this is helpful, it's perfect that Marianne and I are bookending each other. I was the community outreach nurse educator at Wellesley College, and we engaged in a social norming campaign. I think that might be something that is worth considering. I agree with Matt that to reinforce that young people are invincible is not in our best interest, but to reinforce that their leaders and the people that they respect most within their own peer group are wearing masks, and they should be wearing masks, and those individuals are trying to protect other family members might be very helpful, and I'm happy to discuss that. I have limited knowledge about that, but I did see that it was really effective. And then the last M I had on my notes was around management. I am the chair of the House of Representatives COVID-19 team and work group. And what that does is it gives me, I control the questionnaire to the command center. I give this to all of you. Any question you want to ask that you don't want to be directly asking in your own name, but you know that we need an answer to, that we're trying to figure out, send that to me and I will get that on that questionnaire. We get answers within 24 hours from the heads of agencies who are dealing with those issues. And I have weekly access to Secretary Sutters in any way that can help us as we're trying to clarify information. And in any way I give you my word, I will circle back to Dave Davidson, who already has been a tremendous resource for me to understand the CARES money and the money coming into the town. But more than that, I need to understand better the expenses and continue our work at the state level to try and support our towns. So I offer all of this to all of you as a team member, and I'm so glad to see everybody on this call. And I would say one thing, there are some incidents in this town that do merit a hefty fine, perhaps not all, but let's not back up. And it's not, I do not have children presently in the school system, but I certainly have peers that I believe need to have more information about the decisions they're making. So thank you, Mo. Thank you always.
Thank you. We really appreciate your participation here, and as always. I'm going to be calling on Dan Matthews, but I want to make sure that anybody who wants to be heard here would please raise their hand now so we have some idea. Otherwise, Dan will have the last word. Dan?
Mr. Chair, yeah, just very quickly, I wanted to pass on, thanks, Michael, for mentioning that we do have some students at the high school who are working on public service announcements. I'm checking in tomorrow actually with the class at the high school. They were encouraged by the Joint Committee on Health and Safety to do that. So hopefully their messages in their way will help their peers try to keep up the behavior that we're all looking for.
Thank you very much. Dan Matthews.
Yeah, thank you, Mr. Chairman. Just following up on the question of enforcement, and I don't think we had to settle it here, but it would seem based on the discussion, it might be worthwhile for the town manager to talk to town council and review the issue of whether or not our Board of Health has authority to adopt regulations that would give us the necessary tools to do local enforcement here. Seems to me that the science is sufficiently clear and the kinds of instructions and compliance we need are sufficiently straightforward that should be within the board's authority, as I understand it, but it would be town council that would speak. But if we went if that authority was there and the Board of Health decided to follow that route, that would give us the town the ability to use the $50 fine that's in the local bylaw, which I think might be a good tool to address this. Thank you.
Thank you, Dan. If there are no other questions or comments, let me thank everyone from all of the boards in this town who participated, and especially thank our staff whose work is apparent from the discussion today. And I think we all know that they carry a very, very heavy burden in this effort because we all know how many hours they are working on behalf of all of the citizens of this town in what is clearly a crisis for all of us. So again, thank you. Thanks to Sandy Carter for her help in organizing this meeting. Is there a motion to adjourn?
So moved. Second.
Motion's been moved and seconded. Any discussion on the motion? Hearing none, we come to the vote. Mr. Matthews?
Yes.
Ms. Cooley?
Yes.
Mr. Bullion?
Yes.
Mr. Borelli?
Yes.
And the chair votes yes. This meeting is adjourned. Again, thank you very much for participating. And if the